Coming up next is the Dr. Kim Taylor Show. Here's your chance to talk about what matters to you. Although you'll receive helpful advice from Dr. Kim, remember this is not to be construed as any form of psychotherapy, diagnosis, or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Kim by calling 564-1290 or 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. Now, here's Dr. Kim.
Yes, I'm Dr. Kim, and we're talking about parenting today. What does it take to raise a happy, healthy, and well-behaved child? We all want our children to feel good about themselves, and we also want them to respect others and learn how to manage effectively in the world. So, how do you set limits? There's so many parenting styles, and I think I would ask you the question, are you a strict parent or a permissive parent? Do you spank or not spank? Do you have consistent rules and consequences? Do your children listen and respect you? Or have they become the boss in the family and everyone caters to them? What we do know is that parenting styles have been debated for years, but what does seem to stay the same is that we all want what is best for our children, and we want them to grow up and be productive, successful adults. So that said, the strong-willed and defiant kid can really be a handful, and they often prove very challenging for most parents. So with that in mind, today my guest is Dr. Don MacMannis. He's the author of the new book, Who's the Boss? The Win-Win Way to Parent Your Defiant, Strong-Willed Child. So I hope you'll stay with me during the break, and I'll be right back with my guest to begin this conversation. And if you have a question about parenting, by all means, call in at 805-564-1290, or you can email me your question at drkim@drkimtaylorshow.com. Either way, I'd love to hear from you, and I'll be right back after the break with my guest.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
I am here with Dr. Don MacMannis, and we are talking about parenting. And Don is a psychologist and the clinical director of the Family Therapy Institute here in town. And he has been a therapist for over 40 years. And your practice includes children, families, couples, and you specialize in working with kids age 2 to 12. So welcome to the program.
Thank you so much. It's good to be here.
Now, you just wrote a book. This is, I believe, your second book. You co-write with your wife. It's called Who's the Boss? The Win-Win Way to Parent Your Defiant, Strong-Willed Child. So why in the world did you write this book?
Well, Kim, I in my practice now, about 75% of all the kids and families that I see are in this sort of 2 to 12 age range, and that's been my specialty for years. And there's two sort of categories of kids who are the most common referrals, and one is kids with anxiety kinds of problems, and the other one is just kids with behavior problems. So I have like 7 or 8 pediatricians that refer kids to me, and the typical story is, oh yeah, well she got kicked out of her third preschool for biting or kicking or doesn't mind or doesn't listen and that kind of thing. So one of the reasons we wrote the book is simply by the fact that there's so many parents out there who are struggling to set limits with their kids and looking for tools about how to do that, and they don't want to damage their child's self-esteem, but they also don't want to give their kids too much power. And there's a lot of kids who are just running around restaurants, and I think many of your listeners probably can think of personal examples where they've seen children who really just are not listening or minding their parents. So there's a lot of need out there.
Well, and I think you kind of hit the nail on the head when you said that parents are struggling about how to set limits and how to do it in a way that doesn't damage their kids, yet in a way that they can help their kids. And
Sure.
With all the news out there or the books or the advice that everybody is talking about parenting and how to do it correctly. So you've really narrowed this down, and your focus is on looking at kids Between the ages of 3 and 10?
Around 3 to 10. Yeah, there's guidelines for older kids too, but this is sort of a primary area of attention. And obviously, the younger that you can sort of re-exert the appropriate hierarchy in the family is what we call it. Like, that in a healthy family, parents are in charge. And your introduction was a great one, because you sort of, that whole thing of that healthy families have that nice combination of love and warmth on one hand. They're really connected to their kids. They care about their kids. They respect them. They're just very loving. But also the other missing piece for kids who are out of control or who are strong-willed is that there isn't sufficient firmness and structure, so that the parents are in charge. And so what we know from the research on healthy families is that there's that combination of the love and warmth and the firmness and structure that's the sort of essential ingredients.
This all seemed to be so much easier back in the day, let's just say. But you do talk in your book about a lot of dramatic changes that parents have to face, and that how we live in a much more complex world. And so the need is even greater, and it's stronger than ever before, to really help your kids to find out what the appropriate boundaries are, and to provide that for them at a very early age, and don't wait until later.
Yeah, exactly, yeah. And one of the things that I think is fueling the problem or the challenge of that so many kids are not getting enough limits from their parents is, there's the economic stress of two parents working a job, and then they come home and they're sort of exhausted, and oh boy, I don't want to have a conflict right now, so I'll just let him stay up, and as long as he wants or she wants, and that kind of thing. And then they may feel guilty. Parents can feel guilty about not having sufficient contact time with their kids because they've been working or whatever. And that guilt can then fuel them to be a little bit more lenient than they should as well.
And within all of that, who then the parents are really taking care of is themselves, and trying to relieve themselves of their own anxiety.
For sure.
Okay, so parenting through guilt has never been a good plan for success.
Yeah.
But can some parents actually go overboard with discipline, and that they expect too much from their kids also?
Exactly, yeah. And so that's the other extreme. And so if you look at a continuum or sort of a line between what are the two extremes, one extreme is to be too strict, and the opposite extreme is to be too permissive or too lenient. And so what we're looking for, and this is sort of true as a psychological principle, or a lot of the family research shows, is not too much, not too little, kind of like, where is the porridge, just the right size. And so this is one of the areas where you're looking for that fine balance between setting limits, doing it in a loving and caring way, but also having, rules and boundaries, and it's not okay. And a lot of parents, boy, they give, and then they don't get. And they're baffled, like, well, if somebody was so nice to me, well, I'd be nice back to them. And, just we're going through this phase now where just a lot of children feel like they want to be the center of the universe, or they want to be the boss, and then, that's what makes it very difficult.
So what kinds of kids can really be helped through your book and through your advice?
Well, there's, some examples of other kinds of kids. One of my favorites is a little story we wrote up in the introduction. There's a girl named Sarah, and she comes in, and she's 4 years old, and her preschool teacher had referred the family, and the teacher loved her a lot, but Sarah was still having all this trouble. And so, I asked, and this is where this title came from of the book, and I said, it's sort of in a whimsical way after 20 minutes of a session, I said, so I turned to Sarah, and her mother and father are sitting there, I said, so Sarah, who's the boss in the family? And she points to her father. And then her mother just burst into laughter, and she couldn't stop laughing for about a minute, and I finally said, so what's so funny? And the mom said, that is so not true. So Sarah pipes up, and she says, yep, Mommy's right. Mommy wants to be the boss, but I'm the boss in the family, and that's why we're here.
Smart kid.
Oh, my goodness.
Yeah.
The writing's on the wall, but it's not always that easy, and obviously this is one of those examples that I give to parents, because truly it is so important to understand that children who don't have sufficient limits suffer They suffer greatly. They feel guilty. They feel bad about how they're behaving. They know that what they're doing isn't that great. And they really are begging for limits. And so here's a girl who's basically saying, help my parents to control me, please, because I'm out of control. And it really is very scary for kids. They get very anxious when they have too much power in families.
And yet, it's such a fine line, because I know that kids also need to feel like they do have some power, that they can make some of their choices for themselves. There was a time that my daughter, she was young, and I thought that she should put on a pair of socks that matched, meaning that they had to be the same color. And she insisted that she didn't need to wear socks the same color. And we were having a little bit of a tug of war at this point in time, until she turned to me and said, "You are not the boss of me." And so there are times that you do need to allow your child to also figure out who they are, but they need to be able to push against something.
Absolutely.
So that's what you're talking about, is that you have to set those kinds of boundaries and the structure, that they have something to push against, that you're not just the dictator,
right?
But that you can help them to grow and to figure out who they are.
Yeah, and your example is a really good example of the middle way, which is, well, yeah, are we trying to strong-arm our kids and turn them into little robots? Well, absolutely not, because families that are too strict have a whole other set of different kinds of problems. But what's happening there is you want to be able to give children as much say-so about as many possible things, because kids, especially in this age range, are feeling like they're not capable or competent. They sort of compare themselves to adults who are taller and smarter and more articulate, and they can do this, that, and the other thing. And so kids, they really want to, because they have to go to school, they have to go to bed at a certain time. They almost have this illusion that the parents have just total freedom and that they are strapped with all these responsibilities. And so give them all of the decisions that are appropriate for them to have, but not what time they go to bed, or whether or not they have to brush their teeth, or whether or not they have to be respectful to another sibling, or whether, last week I had a mom who came in, and one of her examples was, he doesn't ever let me go to the restaurant I want to go to. What? So the kid gets to choose that they don't ever go to restaurants she wants to, single parent with a single child. But he gets to choose all the time. And if he doesn't, he has a temper tantrum, and then they have to go home, and then blah, blah, blah. So that's just giving kids way too much power.
And that's not the way that the world works. They do have to share. They do have to put aside their needs sometimes and be aware of other people's needs. And so all of what we're trying to do as a parent is to really prepare them for the real life.
Exactly, yeah. The fundamental lessons needed to survive in a world that will not always revolve around them.
I know, shucks. Shucks and darn it.
It was interesting, too, because I saw 60 Minutes, I think it was about a year ago, where they were interviewing corporate presidents and stuff, and saying, oh my gosh, these people who are now we're receiving after they get out of college, is like they think the world should revolve around them, and they should get a trophy every time they say something nice or do something. It's like,
or show up.
Yeah, or show up, and just kind of, well, we've been for too long, I think, giving a little bit too much indulgence to kids.
So you have made a great list in your book about why kids misbehave, and it's for a lot of different reasons. And I think that we should probably go through some of those so that parents know that there is a lot on the kid's shoulder, that there are reasons that they are acting out. And sometimes when you know what your kid is really trying to get and you understand the underlying issue, that it's much easier to see what your role is. So can you just go through some of the reasons why kids do misbehave?
Yeah. First, what I want to say is that usually, almost every time in my experience with families, it's not one versus the other. So people kind of come in thinking, oh, well, my kid's acting out because, his dad left, and so he's upset about that, and that's why he's behaving or misbehaving. And usually, in my experience, there's like 5 or 6 things going on. It's almost like slices of a pie that contribute to the whole picture. But one of the most frequent is that, almost all boys and many girls are sort of born, and there's that attachment parenting piece where when a child is born, you want to make them the center of of your universe. That first year, what we know developmentally is that that's the time when you want to spoil them completely. You want to feed them when they're hungry. You want to attend to them. And that's what we call attachment parenting, and that's a really good thing. But if you continue to do that and don't sort of increase that slope of respect toward you as parents, then kids are, at that point in time, they continue to test. And that's the word that I like to use to describe these kids. They're just testing to see what they can get away with. They want to be the boss of the world. A part of them wants to be the boss of the world, and another part is really scared of all that power and gets very anxious. So that's one, is just that they're testing and they haven't ever been really weaned from being the center of the parent's universe.
Mm-hmm.
And the second one is that a child can be testing out and acting out behaviorally because they want their parents' attention. And so parents will, this whole behavior mod thing of if a child is acting out, that's the only time they get attention. Well, that's a very important fuel for their misbehavior, because if they're ignored when they're doing what you don't, ignored for the good stuff, and then get attention when they're spilling the milk or hitting their little brother, that can inadvertently reinforce and strengthen that behavior, even though parents are saying, well, I'm yelling at them. Yeah, well, it's still attention. Parental attention is a very important element of what drives kids' behavior. And then another one is, sometimes, especially if kids, I sort of warn parents, I say, so here's one of the litmus tests. If you are having to repeat yourself or raise your voice or yell at your kids or count to 10 every time or that kind of thing, well, that's a really important sign that things, ideally will shift, not just for your benefit, but for the child's benefit as well. So when kids are at the effect of their parents are yelling at them, the parents say, Billy, will you go brush your teeth? Billy, will you go brush your teeth? And then it has to escalate. Then parents are upset with their child, and there's this thing called mirror neurons where emotions are contagious in families, and the child will then be getting the parent back because they're mad, but they don't get mad directly because they can't do that when they're at this age, and so they're acting out some of this, behavior stuff. So I don't know. I can go through some more if you want.
Yeah, you list here that even lack of sleep, maybe because they're hungry, maybe because they suffer from ADD or something else that might be going on, that this all can also lead to these kinds of behavior problems.
Absolutely, yeah.
Okay.
I mean, do you want me to talk more about the sleep part? Because
that is a big part of it, right?
Yeah. There's this interesting fact that they discovered in terms of sleeping patterns with kids in this age range, and that is that they can't sleep in. So what you see with the teenagers or anyone who's past the age of puberty, kids who are 15 years old or even 14, they can stay up till midnight on a Thursday night, and then you'll see them sleeping in on a Saturday or a Sunday. They will make up their sleep debt. So what is unique about kids who are no longer napping, but they haven't reached puberty yet, is that they cannot sleep in and make up sleep debt. So you and I and most people know that sleep's important for lots of reasons, for rejuvenation and all that stuff. But we know now that serotonin is produced during REM sleep. When we're dreaming, we're producing serotonin, and serotonin is what we call the policeman of the neurotransmitters. And without getting really too technical, it's the thing that allows the brain to put the thinking brain in charge of the emotional brain. Okay? So if a child isn't sleeping enough, if you have to wake them up in the morning, you know that they're not sleeping enough because they'll wake up when they've had enough sleep. So parents wake their kids up in the mornings on weekdays especially, and then the child's sleep deprived. They don't have enough serotonin, then they don't have enough control over their emotions and their behavior. Mm-hmm. So it's almost invariably one of the first questions that I ask parents is, do you have to wake your child up in the morning if they're in this age range? And if they say yes, I say, I can almost guarantee you're going to get 20 to 80% change in your child's behavior and attitude and all that stuff just by making sure that they're waking up by themselves in the morning, not by an alarm clock or you waking them up or the dog licking them. And once that happens, they're going to have enough serotonin, and then you've got a much better fighting chance of implementing a program and turning things around with the sleep issue.
Okay, well, we need to take a quick break here, but we're going to come right back and we're going to talk about what makes your approach different from others. So stay with me. We'll be right back.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
We are talking about parenting, and if you are just joining us, I have a couple questions. Do you tend to raise your voice or lecture? Do you tend to repeat yourself to get your child to listen to you or to try to get them to behave? Well, I have with me today Dr. Don MacMannis. He's here to talk with us about his new book, Who's the Boss? And it talks about how to have a win-win approach to parenting a strong-willed child. So you offer a lot of tips about positive parents and how to go about that. So talk to us a little bit about what makes your approach different.
Okay. So one of the paradigms, or one of the things that's happening with parents and kids is that sometimes the parents are caring too much about how their child behaves, and the child is not caring much at all. In other words, in the good old golden days, if kids were afraid of their parents or whatever, then there would be a certain reaction that a child would have, and they would care. Like, oh my gosh, if I don't behave, I don't brush my teeth, then some bad thing's going to happen. So the good news is that a lot of parents are not spanking their kids or making them afraid of them anymore, but the parents really care, behave, but then there's no way for the child to sort of take responsibility for their behavior because they don't really care if the parent's upset with them. So what we've done is developed an approach that I've had with over 1,000 families in the last 30 years, and that's what I've written about and done the research behind. And what we'll do is we'll sort of make a child's willfulness an asset instead of a liability, because the parents are not telling their child to misbehave, but it's kind of a fun star chart system where the child is earning stars for each day where there's improvements and that kind of stuff, and then they get to be the boss. They get to be the boss of the parents for a certain chunk of time that evening, and because it's that evening, then it's a very kind of close connection between their efforts in behaving that day and the payoff. So that's one thing. A second one is that there's really important instructions about how parents can handle their own emotions. So what I've learned from being a parent and also, coaching parents about how to use these kinds of systems is that there is nothing that is so upsetting than have your child in your face. Basically, parents are saying under their breath, if they're honest with themselves, oh my gosh, you little whatever, I bust my butt all day, I work, I do, I just really give you all this love and caring, and you're telling me you're not going to brush your teeth? So, parents are, their emotional brains are just as if a tiger's attacking them. They're kind of like, they want to scream at the child, you ungrateful. And they don't do that. So we go into very specific ways that parents can lower their own emotionality through constructive expression, not at the child, but on their own, sometimes through exercise, sometimes through other methods, but also then be able to take some slow, deep breaths and put their brain in a quiet place. And that connects back to the idea that in families, emotions are contagious. So if parents are parenting with anger, then their child is mad too. So we give really specific instructions and guidelines about how to do that.
So Don, just so that we know, and for those out there that are hearing you, give us examples of one of the exercises that you use to help parents calm their frustration, their negative feelings, their anger, their upset.
Okay.
What is something they could do?
Well, I'll tell you one thing that was actually, because here's the thing, I talked about, reducing your own sort of caring about things. So I would coach this mom about, okay, so Tommy, I've asked you to clean up your toys. Would you like to do that now, or do you need to spend some time in a timeout? And it's a different kind of timeout than the typical thing of the 1 minute per age of the child, and it's important that we do that because it teaches emotional control and self-regulation for the child. Okay, so I've got this parent, and she's saying to me, when my child is misbehaving, I get so irate. I get so mad, and what I'm in touch with is the fact that I didn't get a lot of positives when I was growing up. My parents asked me to behave. I just behaved, but here's my kid, and he's not doing that, and I get so mad. But I figured out what to do. I go to the bathroom, I close the door, I take a towel, and I scream in the towel for like 30 seconds, and I'm screaming, shape up, you little whatever. And then I take some slow, deep breaths, and then I can do what you're talking about, which is I can come out and I can, deliver the choice to the child. And once again, when you give children the choice of behaving or not, then they feel empowered. And that's kind of the paradox. With strong-willed kids, you don't want to tell them what to do, but here's the choice. You can either do what I've asked, or you can have this consequence, and then you let the consequences do the work.
Okay, and then
so it's a
the child chooses too, right?
The child is choosing. Okay. Just like you and I choose whether to speed home on 101 tonight at 100 miles an hour, knowing full well we're going to get a ticket. The cop's not going to yell at us. They're not going to scold us. They're not going to guilt trip us or even threaten us about, well, I'll do this again, and then I'm going to, you're going to lose your privileges for the weekend or whatever. But you asked the question about, so what do parents do? So that's one piece, is simply the momentary kind of like go scream in a towel. It also really helps people if when they're exercising they can vent some of their frustrations. There's really fun and great research coming out of Harvard Medical School about the use of exercise as a form of reducing emotionality, because all it is really, Kim, is as you well know too, is that we've got adrenaline and cortisol in our blood system, and that's readied us for fight or flight, and we want to reduce that in the quickest way possible, but not by screaming at our kids and then fueling the behavior problem. So we do the constructive expression, and then obviously there's the tools like mindfulness and being able to slow, deep breathe, and that kind of thing is really helpful too.
Okay, but you are teaching parents that it's okay to express your feelings and to get those out, and that then the parents can also let the kids express a feeling and let the feelings out, but then they are teaching them how to react to that in an appropriate way that isn't going to hurt somebody else. Exactly. And is within the boundaries and limits. So what the parents are also practicing is also what they're going to be teaching.
Exactly.
Okay.
And modeling that, or there are times when it's really helpful for a parent to show a child either through the exercise or punching a punching bag or doing something with that extra energy about how to vent that. And as you and I both experience on a day in, day out basis, it's just kind of like feelings, and handling big feelings is such a huge part of what everybody struggles with. We're so over socialized in some ways. The ability to cry, the ability to get angry in constructive ways is really what the body is crying out for. So in this process, I really shy away from try and stuff it, try and stuff those feelings down. Just recognize them, be honest with them, vent them constructively, and then go do the business of parenting with your child. So that's kind of the 1-2 punch.
The part that you were just saying also about in all of this, by giving your child then choice, that you then instill a sense of personal responsibility within them to be able to choose, okay, if I do A, then I know that B is going to happen, and if I do C, then I know that D is going to happen, and they get to choose which one of those that they want.
Exactly.
Okay, so it's not always being told then what to do and feeling like somebody is dictating and having power, that the power then is within, and you get to choose.
Exactly, and even with the language, this is I just had a family in this last session, and they use the word need a lot. Charlie, I need you to da-da-da-da. I need this, and it's like, so the word need tends to push people's defensive buttons. And if you can say it more, language it more kind of like, I'd really appreciate it if you would please. I'd really like you to please. And always use the word please. So to the degree that the child feels respected and cared about and nurtured, but then they don't do it, then, okay, well, that's their choice. And then they learn very quickly that, hey, it's not so fun to have a timeout. And wow, I can learn these stars by learning, how to behave better, and then I get my parents to have some fun with me, and the families earning fun family time together by their children being attentive to, wow, here's a really fun, cool thing that doesn't cost parents money, and it doesn't, And it's what kids are begging for anyway, which is some good old-fashioned one-on-one quality attention.
Mm-hmm. Well, and I actually liked what you said in the book, too, that you said that if your child isn't upset with you some of the time, then you probably aren't setting enough limits. That a parent's job is to set those boundaries, and the child's job really is to push against those boundaries just as a way to figure out who they are, what they can do, what the rules are, and it's also a way to help them separate from you, so it helps them develop a really good, strong sense of self.
Exactly.
You talk in your book about discipline and spanking. Why do you think it's really important to avoid spanking kids?
Well, there's a number of reasons. There's actually a few prominent authors out there, actually one who wrote a best-selling book on strong-willed kids, and who think that spanking's okay, but, almost all the research and almost all parenting experts now do not advocate the use of spanking. In my own experience, working 40 years of trying to help kids in this age range, I have never seen a kid who needed to be spanked or who couldn't, respond in a positive way to the other methods we've outlined. So what happens with any form of punishment or consequence is that there's the desired effect, just like with medicine, and then there's the stuff that's what we call side effects. So the side effects of spanking, it can give you the illusion that you're stopping a behavior if you're spanking a child. In other words, you get immediate feedback, oh my gosh, he just shaped up because I just spanked him, and so, but what happens is that when kids are spanked, they will have their self-esteem damaged to some degree because they identify with their body. So if you're hitting my body, well, then I'm identifying with that, and so you're hurting me rather than you don't like my behavior kind of thing. You want to communicate to kids that you love them dearly, but it's this behavior, and you make that separation between those two. So that separation's a hard thing to accomplish when you're hitting kids. A second one is that, what I've already talked about is we want to reduce that emotionality, the negative, angry kinds of feelings in the family, and kids definitely become angry when they're spanked, And once again, I don't want to freak people out and think, oh my gosh, I spanked my kid and I've ruined them. Well, that's not the case. If an occasional spanking happens, the research shows that that's not the most terrible thing in the world. What's problematic, very problematic, however, is the flip side of that, which is if you're spanking as a pattern and that's one of your primary parenting tools, then all these negative side effects happen. And then the third one is that the third other disadvantage of spanking kids is that what you're modeling is physical force or violence. And so you're teaching that aggression, physical hurt is a way to work out differences with others. And so this is something that tends to get mimicked in schools where parents that spank their kids and or are too strict, even though they could be acting like, more like perfect little angels at home, they are much more likely to be showing acts of aggression in the school and, having physical problems with how they're dealing with peers and stuff like that.
Yeah, there was a time I was brand new. It was my first internship, and it was to work with kids. And my very first little client that walked in the door was 5 years old, and she walks up to me, and she kicks me in the shins.
Whoa!
And it was all about all of the kinds of abuse that maybe she was seeing at home or the way that she was treated at home. But, she let me know just in that one swift kick exactly what her world was like. It was really wonderful.
Yeah.
So part of what we need to talk about, too, is that for parents to be able to be effective in this and to actually co-parent, they have to be on the same page.
Oh, yeah.
And if there are a lot of high levels of conflict with the parents, that they probably should first go to couples counseling and try to seek help for themselves first, because this is not going to work if the children can keep splitting them and keep being on each parent's side. I find often that once the conflict and the tension is reduced within the parents, that a lot of time the tension and the conflict gets reduced within the child too.
Absolutely, yeah. And lots of times it's what I would consider a necessary thing, but sometimes not sufficient. In other words, I see plenty of families where the couples, to their credit, because this didn't happen years ago, but they say, our son has a problem, but we know it's us. And so they'll do some couples therapy, and they'll work on, learning how to communicate typically emotions and stuff, and resolve and get forgiveness going and all that, starting up some new positive ways that they're interacting as a couple. And then the kids are okay.
Uh-huh.
But sometimes, and actually probably most of the time in my experience, then after they've accomplished that and they can work as a co-parenting team, and sometimes it's also when they've split up, too, that this is the case. They've already divorced, and now they've got a kid who's acting out. But then they need some fine-tuning of the parenting skills, because, a lot of this just, we didn't learn it growing up. Many of us in our older years were brought up with guilt or shame or spanking or whatever, and so we need some new models to meet the challenge of kids today.
And we are going to talk a bit more about your model and the way that it's important, you say, to list the family rules and for all members of the family to adhere to those rules. So we're going to take a quick break now, but we'll be right back.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
I am here with Dr. Don MacMannis, author of the book, Who's the Boss? The Win-Win Way to Parent Your Defiant, Strong-Willed Child. So, Don, what exactly do you mean by a win-win?
Well, the win-win is the element of that kids can actually have fun when they're learning how to behave. And it's by sort of rearranging that whole power struggle where the kids can feel like they're in charge of their lives and they're having fun. It's hard to believe, but, constantly I get the feedback from parents of, this is so amazing because my child is so much happier. And it comes back to that, what I spoke about before, is that kids feel so bad about themselves when they have all this power and control. They continue to want it, but they also feel bad about themselves. So they feel better about themselves. They are more loving. They're more creative. They're more spontaneous. They're more respectful of other people, and their academic scores go up. And the parents are obviously happier because they have a happier child, and they're also going to have to spend all this time and energy in that endless sort of conflict and control struggle kind of thing.
I think also that kids feel safer. That's not something that you mentioned, but I know in your book you talk about that with the structure, knowing that someone is going to come and tell them that's enough, no more, that it does help them feel safer in their world so that they don't have that anxiety about not knowing how far they can go and what is going to happen next.
Exactly. And as a parent, what you're providing is the container for their emotionality. Like, they don't feel safe as long as they feel like they have so much power. They feel guilty and they feel really anxious. An example of that is I get a lot of kids who the pediatricians are asking, is this a kid with ADD? Because they're wiggling around. It's like, in a lot of cases, a child does not need medication. What they need is more effective parenting. And then you see this ADD kinds of symptoms, which is sort of like the out-of-control behavior stuff. It softens to such a considerable degree that it's like, no, he's not ADD. He's just needed more limits.
Right. And when parents provide that, kids can also use that as the excuse with their peers by saying, sorry, I can't do that because my parents will kill me. And so they don't feel so bad about not pleasing their friends because they can use their parents to set that kind of limit.
Yeah, especially with the teens, too.
Oh, yeah.
That one. Yeah.
Okay. So in your book, you do describe a very concise method and procedure for parents to use this win-win way of turning things around. This is geared toward children ages 3 to 10. Maybe your next one is about the teen years. Just a hint, because people need that out there too, especially if they didn't do it between the 3 and 10-year-old age group. And one of the things that I kind of want to end with is that you did talk about the great importance of being able to increase the number of positive times that you spend with your child. So you talked about it and explained it within a 5-to-1 ratio. Mm-hmm. Can you tell us a little more about that?
It's a fascinating thing because, there's been research in classrooms and families and couples and even in organizations and businesses, and they come up with the same finding regardless of the research, and that is that if I'm interacting with you, that it's going to be 5 positive interactions. Now, that can be a smile or a hug or a handshake or an appreciation or sharing praise or anything like that. Or even asking you, hey, Kim, how's your day going? It's like that's a positive connection. And that it's a 5-to-1 ratio of positives to either neutral or negative kind of things, like, Kim, I'm upset with you because you didn't clean up your room kind of thing, that brings out the best in people.
Mm-hmm.
So it's fascinating. Another thing that I heard, I guess it was from the neuroscientists, is that our brains are wandering around the earth looking for validation. Our brains settle down. We want to feel validated. We want to be seen. We want to feel heard. We want to feel respected and that we're okay. And that's what happens in the positive, in the 5-to-1 ratio. So I had a family, that's the same family I saw this, between 4 and 5 today, and they hadn't done the other elements of the book. They read the book, and they started the 5-to-1, and I said, well, how much improvement? And they said, at least 75% already with their 5 kids, just by lowering the negative emotions and starting to catch the kids being good and starting to, lots more smiles and hugs and appreciations. And they've got the kids appreciating each other in the back seat of the van. And it's working. I mean, it's contagious.
Yeah. Okay, I am talking to Don MacMannis. Don, where can people find your book?
Well, we have a website, and it's called strongwilledchild.com.
Okay.
So that's the best place. Strong-willed is hyphenated, so strongwilledchild.com, and then we sell it here at the Family Therapy Institute. It's also on Amazon, and you can just get the links very quickly from the website.
Perfect. And I will also put those links on my website. Thank you very much for being with us today.
You're welcome. My pleasure.
I'll be right back with some closing comments right after the break.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
If we want our children to be well behaved, then we really do need to have to be willing to spend the time to work with them and to play with them. We need to acknowledge and praise their good behavior and to really help them to learn how to deal with their own feelings, whether it's of anger or frustration. And yes, of course, we also need to set the appropriate limits and the boundaries for them to help them figure out the world. But these are most effective when children know what to expect in advance and that they are delivered within an environment of love and support. So if your child refuses to follow the rules and it's not working, then there may be a deeper problem going on, and you may need to be willing to seek outside help. But you need to get to the real problem so that you can get back on track with your parenting. Thank you for joining me today. I'm going to be back here next Thursday afternoon, as I am every Thursday afternoon, live at 5. So I hope you will join in, listen. And if you have a question, just get on the phone, or what most people are doing is send in an email and I'll answer your questions at drkim@drkimtaylorshow.com. This show is rebroadcast Thursday evenings at 10 p.m. and Sunday mornings at 9 a.m. You can also download the podcast on iTunes and just look it up through Dr. Kim Taylor's show. Thank you, Mark Giles, my engineer. And until next week, remember, nobody else has to change in order for you to feel better. Take good care. See you next week.